I woke up on a Sunday morning and I had this awful, awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me, and they gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing, and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.